Welcome back. We've been talking with Representative Kathy Sims, who is in her first term in the House. She served some years back. She's from District 9, and she's been talking to us about urban renewal. And Kathy, you have a pamphlet there?
Yes, this is one. This is our fifth printing of a book we've had out for about 4 years, trying to explain to the voters what it is that urban renewal does good, what it is urban renewal does bad.
And so for those who are listening on radio, can you tell us how they can get a copy of it and what it's called?
The book is called Taxation Without Representation. And if you just send me your address by my email address at mkathleensims@gmail.com, I'll see that you get a copy mailed to you for free.
And Sims is S-I-M-S.
S-I-M-S. It's
okay.
M. Kathleen, K-A-T-H-L-E-E-N, SIMS@gmail.com.
Thank you very much. We appreciate it. Now we're going to turn to Senator Monty Pierce, who's from District 9 in his fifth term, and he's going to talk to us about, I guess it's called the Patient Protection Act, but commonly referred to as ObamaCare. Where are we in Idaho with this? I know they were talking about some exchanges, and can you tell us a little bit about how that works?
Yes, we're, in fact, one of the struggles that have been facing the legislature this year is the federal government has sent out $20 million for us to establish a government health insurance exchange. And that money's sitting there, in a sense, waiting for us to appropriate it for use for that exchange. And the great discussion is we're presently in a lawsuit with the federal government saying that we don't want to participate in Obamacare. And so for us to go ahead and implement the implementing machine of Obamacare would be
confusing.
A mistake.
Yes, it would be saying we're not going to, but if you use the money, then they're going to say, well, yes, you are.
I think it truly weakens our lawsuit that we're involved in.
Absolutely.
We have hopes of winning major parts of that, and so then for us to go ahead and join up and implement it seems to make no sense.
You know, one of the things that is surprising to so many people is that when you hear about health care, it doesn't matter whether you're Democrat, Republican, Libertarian. If we all say that health care is important and we should have a discussion about it, that's one thing. But I've got a chart here that's out of the New American that talks about how many agencies will be developed or started, created as a result of this. It's 159 agencies, and some of it talks about homeland security and things that have nothing to do with health care.
The Obamacare is really truly more than health care. It is the overall care of the individual. And so they have agencies look after every part and parcel. You know, for a government that's going broke as rapidly as we are, to put 159 new agencies into effect in order to implement one law does seem mighty ridiculous.
Well, 2,000 plus pages, and they had to vote on it so they could read it, which, boy, in Idaho, that wouldn't fly, would it?
You know, we've just lately seen the big tussle over the fact that the Catholics will have to dispense things that are against their religion.
Right.
We're just beginning to find those real heart and soul things out about it. It will fund abortion, which has been a major issue, and pay for it, require the states to pay for it. It has some major problems and implications. You know, today when there's so much society breakdown, it even has it's the way it's written, the way the healthcare requirements are, it is even anti-marriage, because if a married couple is making like $50,000 a year, it's cheaper for them to not be married and have health care than it is for them to be a married couple, which is positive for children. It's positive for society. It's just, marriage has worked in America for hundreds of years, and all of a sudden to have the government giving incentives not to be married just really seems wrong. And all through this Obamacare, we find these sorts of things.
If the camera can zoom in on this, and I don't know if I'll do my best to hold it, you will see the agencies. You can see how this starts with the president and then goes on down. The interesting thing is you see the Department of Homeland Security, the Treasury Department, the IRS. I don't know how any of this has anything to do with health care.
You'll be given penalties if you don't participate.
Oh my.
And if you don't, and of course, many people will take their employees off the health plans they have now because it's cheaper to pay the penalty than it is to furnish health insurance for your employees. So it has some tremendously far-reaching implications. Back to the healthcare exchange part, though, I believe, which is something that's before us right now. Utah has a nationally touted healthcare plan, or exchange, healthcare exchange, and they implemented that a number of years ago. And they started in August with 180 companies bringing their employees in and putting them on the health insurance exchange. And between August and December, that number had declined to 13 companies from 180. And so it wasn't what it was touted to be. And today, they went back in and again revamped it, tried to make it where it would be effective. They have over 300,000 eligible workers, and there's less than 5,000 on, which is less than 2% of the state is on their healthcare exchange now. So it's not what it's touted to be. It's not what it's represented, but it is the implementer of Obamacare. And for that reason, we're told, too, that we need that buffer between us and the feds. It is the federal health care exchange that has their own plans and implementation things, the requirements. And so for us to set up their requirements is the same as them doing it. It is I think it's a
They're
false...
having you do it for them.
Yeah, making us do it for them. Because they're going to say, this is the pattern you have to follow, this is what you have to do. So what's the difference between them doing it and us doing it? There's no difference. And so there are a number of things that we can do today and that we should do, and we're working on it. One thing is to be able to buy insurance across state lines,
Absolutely.
health insurance.
Oh, the competition will bring all the prices down for everyone.
Well, now, that's a question that I have, because they talk about these health exchanges and say that it will bring competition. Will it really?
Not with healthcare exchanges, it won't.
Okay, so tell us exactly what happens with the healthcare, because people are under the impression that we're going to have competition and that the cost will go down. But oftentimes, the things that we think they do, it does just the opposite. So explain to us.
Well, not dodging your question, but there are things we can do and to be positive. It's one thing to just say, no, we won't do it. It's another thing to say, here's what we can do. And we can open up our state and allow other companies to come in here and market health insurance. And whether we license them or whether we say if you're licensed in other states, that's good enough, you can sell insurance here. We can do that, and that will cheapen insurance here. Of course, our local providers
will lobby hard.
They don't love that because they don't want competition.
We call that the blues. Okay,
Yeah.
so it will open it up, and other companies will be able to come in. I can't remember. I think it's not Synergy. There was one that was on television that a lot of people looked into, and not allowed in the state.
Right. That's not licensed to function here. And so we've done those things, and there's another one we can do. We can lower our premium tax and use that money. We can build a private insurance exchange, which is simply where people shop to find the most effective and the kind of insurance that fits them. But it's not as simple as and as good as the sales job is telling us that it is.
Well, how do we get the word out to people? Because quite frankly, until I saw this chart and saw that, what we thought was health care includes the Department of Justice, the IRS, and then we start finding out about these mandates you were talking about, the mandate for abortions, and there's probably, if there's 159 new agencies being established, all of them have to be staffed, all of them have to be funded, and all of them have to be housed. The cost of this has got to be just
with government
amazing.
involved.
Outrageous.
With government involved, the sad part is they're going to destroy the best health system in the world.
Exactly.
We have problems in our health system now, but they're going to destroy it because what happens, they will assign you a doctor. And so you can't shop for the doctor that you want.
Socialized medicine.
So you'll have to take the doctor they have. And so all of a sudden the doctors then have no incentive because they're on the federal, eventually will be on the federal payroll. And so overall health care and us older folks, when they look at us and say your productive life for society is running out, you get the end of the line. That's what happens in all the other socialized medicine countries. And so you don't get care. And the younger people, well, you've got 30 years of taxes in you. We'll go ahead and take good care of you.
Absolutely.
I mean, that's really how it's going to work.
I remember having this discussion with some people from Canada who you hear people from Canada, some love it and some hate it, but they were coming over here for health care, and my husband read, and I can't remember where he read this, that for a pregnant woman, the waiting list to see an OBGYN for a pregnant woman was 13 months. So he says they're going to have to write some law that changes the gestation period.
That'll be too late.
Be quite interesting, isn't it? So, yeah, I know we have family that live in Canada that come down here on a regular basis for health care.
Because when they need something really done, this is where you can get it done. You get done quickly. Mm-hmm. And instead, if you have a serious problem and they say get at the end of the line and wait your turn, that you'll die before you get treatment.
Well, and you can't shop for specialists like we can here.
Right.
If you need a specialist of some kind, I mean, you can go to Seattle or you can go, someplace where...
And what about the doctors? I mean, these people take a lot of time to get their education, and if they specialize, they take even more time. So what is it, I mean, their love of the work, their love of helping people, that's fine, but you can't work for free.
No.
And you can't put the kind of money that you put into education and not be able to pay it back.
You wonder how many doctors will lose. And
Exactly.
that's a frightening
Exactly.
thing,
That's
because
what my
they've already
concern is.
invested in their education. They also have a love of the work, but if they can't put it together with their families and their investment, they'll do something else or go somewhere else.
And if they sign you to a doctor that you don't like, that you're not comfortable with, that you have a personality conflict with, you're out of luck.
Oh my goodness. Well, I know several doctors here that I've talked to, specialists, who have said they keep cutting what they can charge anyway, and it's bad enough that government starts saying which businesses can fail and which can't. That's what they're doing now with medicine through this.
Well, imagine the paperwork with 159 agencies. Just imagine.
Well, I just can't imagine the money, and I can't nobody's been able to explain to me what Homeland Security is doing in this. That raises my antenna, because I'm thinking, what does that have to do with health care? As I look at this chart and start seeing where Secretary of Health and Human Services is right here in the middle, but you see the IRS and all of these other departments. If people are interested in getting a copy of this chart, if they will email us, maybe we can get a copy of this to them. If you go to fyidaho.com, we'll see if we can either have one there, or you can email us and we'll see what we can do to get you a copy, because this is very telling.
Oh, it's very telling.
So what are we going to be doing besides health exchanges? What will we be dealing with this year in the legislature?
Well, hopefully open up the state lines. There's looks at writing or directing or encouraging private exchange. I think that we need to look at a lot of different angles to make health insurance much more affordable and available.
And what about our lawsuit? Where are we with that?
We're just waiting to hear. It's
Just
before
waiting.
the Supreme Court.
Okay.
How many states are also doing it? We're not alone in this.
Oh, many states have rejected. In fact, some states started their insurance exchange and then backed off and dropped it and said we're not going to do it. Governor Brownback and I think several of them, Bobby Jindal, they've all turned their back and said we will not do it.
So the only legislation before the legislature, though, is the health exchange.
Whether to do or not do the
Okay.
exchange, yes.
Well, thank you both for being on the program.
All right.
Really
Thank you
appreciate
so
it.
much for this.
Thank you.
You bet. Thanks for joining us. Until next week, I'm Elizabeth Allen Hodge.